Good morning, everyone. I would like to thank Kusog Mindanaw, led by Conference Chair Mr. Charlito Caloy Manlupig, and Convenor Attorney Benedicto Bacani, for inviting the Department of Health to this event, as it paves an avenue to share with everybody how the Department of Health, together with the local and national governments, have supported environmental health during this COVID-19 pandemic. The new decade started with a significant challenge across the globe. Currently, we are still facing the challenges of responding effectively to an ever-unraveling crisis with many unknowns, that is the COVID-19 pandemic. Climate change is evidenced by the presence and coming of extreme weather events such as super typhoons, flash floods, and landslides that had become inevitable events. The Typhoon Maring that devastated the northern part of Luzon is the recent manifestation of climate change. Other regions had been hit in the past, thus sending us the message that these effects can occur anywhere and does not define any boundaries anymore. According to the World Health Organization, climate change endangers the basic determinants of health: clean air and water, sufficient food, and safe and adequate shelter. It has always been a challenge to protect the health of the population from the impact of climate change and how to translate health adaptation measures to reach the most vulnerable groups, such as the poor, the elderly, and the children, persons with disability, pregnant women, and sick persons. Climate change in the midst of a pandemic is another story. Even as we continue to grapple with the effects of the COVID-19 pandemic, the Earth continues its cycle, hence, climate change still remains an earnest concern. The effects that humans have brought to this world, both the good and the bad, continue to be felt and seen. The Department of Health in this time of the pandemic has been faced with the challenge of rapid surge of infectious wastes in the demand for COVID-19 treatment and care that are generated in our healthcare facilities, quarantine and isolation facilities, and even in our homes. This is coupled with the surge of used face masks and face shields from individuals in the practice of minimum public health standards. The DOH issued policies to respond to this challenge. Some of these policies include Department Memorandum Number 2021-0031, or the Interim Guidelines on the Management of Healthcare Waste Generated from COVID-19 Vaccination, and Department Circular Number 2021-0439, Operational Guidelines on the Reverse Logistics of COVID-19 Vaccines. While we have these issuances, other agencies like the Department of Environment and Natural Resources have also addressed this concern in view of environmental protection. It has been more than a year since we have started this battle against COVID-19. Thousands had been infected and lives had been lost in the process. Up to this day, we are still learning about the different possible factors that could attribute to its transmission. Because of this, we have to be aware of particular conditions that can be factored in from our environment. The Centers for Disease Control and Prevention recommends the thorough washing and disinfection of food purchased prior to handling. As much as food packages, and food handlers have not been identified as a risk factor, the virus can persist on surfaces between a few hours or days. The process of preparing our meals play an important role in the spread of COVID-19. Food handlers should continue to follow our minimum public health standards in their workplaces. Good sanitary practices are advised when moving and preparing food. We should not forget washing our hands regularly, separating raw meat from other types of food, cooking at high temperatures, and storing unused food in our refrigerators. Besides the prevention of COVID-19, we should also be wary of other zoonotic diseases that can be transmitted through improper food handling. In addition, the WHO recommends the 5 keys to safer food. First, keep it clean. Separate raw and the cooked. Cook thoroughly, keep food at a safe temperature, and use safe water and raw materials. Last October 15, the Philippines joined the global community in celebrating the Global Handwashing Day. This global advocacy aimed to increase awareness and understanding about the importance of hand washing with soap as an easy, effective, and affordable way to prevent diseases like COVID-19. In the Philippines, the Department of Health, together with the Department of Education, WHO, and UNICEF, led the Global Advocacy Day dedicated to promote awareness and understanding of the importance of hand washing with this year's theme, Malinis na Kamay para sa Kinabukasan ng Bayan, that featured good practices such as use of behavioral nudges or simple cues and establishment of hand washing facilities. This supports the school's initiatives on water, sanitation, and hygiene or WASH to ensure safe drinking water and the use of proper sanitation facilities. We know well that COVID-19 can be transmitted through acts such as sneezing, coughing, and talking to people in close range. We should be aware that areas with high levels of PM 2.5 or particulate matters measured to be 2.5 microns or below and nitrogen dioxide were associated with increased viral infections. A study in Peru showed that 1 unit increase in PM 2.5 concentration was associated with a 9% increase in COVID-19 related fatality. It has been observed that there is a significant correlation between the levels of air quality and COVID-19 infection and mortality. We must pay close attention to our communities that are continuously exposed to indoor air pollution, which could contribute a greater risk of being infected with COVID-19 and in turn results in a wider transmission of the virus. Our partner DENR has this new policy on the PM 2.5 entitled Establishing the Breakpoints of PM 2.5 Air Quality Index that serves as the guide for the general public on the cautionary measures on different levels of air quality for PM 2.5. Temperature and humidity have a role in the mobility of the virus and may have effects on the transmission of COVID-19 as proven by a study done at Bangladesh. Regions with mean temperature between 7 degrees Celsius to 25 degrees Celsius per day have a higher number of cases and fatalities compared to regions with mean temperature above 25 degrees Celsius per day. Their study noticed that there were increasing cases and fatalities at locations with 65% to 80% mean relative humidity per day. This condition was seen to be optimum for the prolonged survival of the droplet nuclei in the environment. Proper waste management should be emphasized to avoid further spread of infection in a clinic or hospital setting or through any institutional, commercial, industrial establishments, community quarantine units, or any facilities with other similar healthcare services with activities or work processes that generate healthcare waste. Because of its wider scope, we need partners like the Department of Environment and Natural Resources and the Department of Interior and Local Government. Virus-contaminated healthcare waste could possibly infect workers in the waste management industry because of the direct handling and poor safety practices. Waste could be disinfected and properly segregated to provide better healthcare waste management. Temporary storage of up to 9 days can also be done to prevent the spread of contaminated waste. The National Solid Waste Management Commission Resolution Number 2020-1364, or the Interim Guidelines on the Management of COVID-19 related healthcare waste, addresses the management of COVID-19 waste. The resolution highlights all waste are properly segregated and not mixed with other domestic waste. Second, public health and the environment remains to be protected. And third, waste workers will not be exposed to all environmental and health hazards. The DOH is not alone in this challenge as we have partners like the Department of Environment and Natural Resources assisting us in the management as to transport, treatment, storage, and disposal of infectious waste in accordance with its existing laws. We also have the Department of Interior and Local Government through their local government units that assist us in the proper management of their vaccination waste in terms of segregation, on-site collection, transport, storage, and disposal. In order to combat a specific form of infectious waste, the Department of Health has this Zero Open Defecation program. Open defecation is a known practice of passing feces outside a latrine or toilet. Exposed fecal material can attribute to food and water contamination, which can result in higher incidence of diarrhea, cholera, worm infestations, hepatitis, and other related diseases among the community. Because of this, the Zero Open Defecation Program aims to contribute to the realization of the National Sustainable Sanitation Plan by eliminating the practice of open defecation. We are currently at 14,239 or 33.79% total zero open defecation barangays. We aim to hit the target of 90 to 100% by 2023. Continued provision of policies, guidelines on essential health services during the COVID-19 pandemic were issued through Department Circular 2020-0167. In line with AO 2017-0007, the water, sanitation, and hygiene requirements of the general population shall be met primarily through the following components in accordance with the national and international standards. First, hygiene promotion including hand washing and hand hygiene. Second, water supply. Third, excreta disposal. Fourth, vector control. Fifth, solid waste management. And lastly, drainage. Despite that much of their time were devoted to COVID-19 response for community space disinfection, the sanitation inspectors at the local health units continue to provide water, sanitation, and hygiene or WASH services, which include drinking water quality monitoring, inspection and regulation of food establishments, issuance of sanitary permits and health certificates, participation in vector control activities, toilet construction, managing disposal of COVID-19 deaths, and facilitation of the management of vaccine waste like collection, transport, and disposal. The integration of climate change, environment, and health is a remarkable move. Definitely, the Department of Health is walking the talk as we, in the DOH, together with the DENR, annually celebrate the integration of health and environment. Recognizing the importance of having health and environment at the center of sustainable development and to protect and advance the right of the Filipino people to balanced, healthful ecology and right to health, President Duterte signed Proclamation number 595 series of 2018, declaring every September 26 of every year as the World Environmental Health Day in the Philippines. For this year, the World Environmental Health Day, the theme is Kaligtasan at Kalusugan sa Kapaligiran, bida sa pagbangon ng lipunan. In the interagency level, the DOH chairs the Interagency Committee on Health or the IASE with DENR as the vice chair and 10-member agencies, the Department of Agriculture, Department of Science and Technology, Department of Transportation, Department of Labor and Employment, Department of Public Works and Highways, the Department of Trade and Industry, Department of Interior and Local Government, National Economic and Development Authority, the Philippine Information Agency, and the Department of Information and Communications Technology. This is based on the IASE resolution on the implementing guidelines of the EO number 489 series of 1991, which is institutionalizing the IASE. This Interagency Committee on Health oversees the National Environmental Health Action Plan or the NEHAP of the sectoral thematic groups, namely water supply and sanitation, air, solid waste, chemicals, food, occupational, and climate change. For sectoral groups, the collaboration and coordination of member groups in the sector are being addressed to have unified directions and synchronized actions. The NEHAP sets the national level direction on priority environmental health issues aligned with the Sustainable Development Goals, which all agencies adopt and adhere to. For climate change, the National Environmental Health Action Plan underscores the need to build the adaptive capacities of women and men in their communities, increase the resilience of vulnerable sectors and natural ecosystems to climate change, and optimize mitigation opportunities towards gender-responsive and rights-based sustainable development. With this, we do hope that we can work together in the attainment of this goal. Finally, on building climate-resilient health systems, the Philippines, through the Department of Health and in collaboration with other national agencies like the DENR and the Climate Change Commission, is working on the requirements of the Green Climate Fund for the approval of a project entitled Strengthening Health Sector Resilience to Climate Change and Disasters in the Philippines. This aims for climate-resilient environments, especially the most vulnerable sectors and communities. Health sector resiliency that includes infrastructures and health systems are the main elements of this proposal, as well as supporting community resilience through technical assistance and local coordination and networking. Hopefully, this project on climate change and health will push through with the Green Climate Fund, as this project will achieve these goals: climate and disaster resilient leadership, governance, and coordination, climate and disaster resilient healthcare facilities, integrated health surveillance system, increased preparedness and response capacity to climate change and disaster, and community health service delivery for recovery and resilience. The Green Climate Fund was established within the framework of the United Nations Framework Convention on Climate Change as an operating entity of the financial mechanism to assist developing countries in adaptation and mitigation practices to counter climate change. Through this Green Climate Fund, we are hoping that the proposed project will be approved as it aims to strengthen climate resilience in the country's health sector to protect the most vulnerable sector people of the Philippines from the extreme weather events induced by climate change. With concerted efforts and sterling commitment to advance innovations, we can capably combat the effects of climate change even in the face of the COVID-19 pandemic. The Department of Health remains relentless in this pursuit, and our partnerships and linkages with stakeholders will continue. This will be my last slide. As the COVID-19 pandemic continues to affect people and countries around the globe, we must continue to protect our environment because everything is interconnected. And with these steps that the government has undertaken, we hope to give our world a fighting chance against climate change and its detrimental effects to health. Daghang salamat po.